So joining me today on the show is Lara and Lindsey from Digivate Health. Lara and Lindsey, how are you?
Yeah, good, thanks.
Very well, thanks.
Great to have you on the show today. Keen to dive into more about what you do at Digivate Health and explore that digital health ecosystem a little bit more. So firstly, I might go to Lara. Introduce yourself. Tell us a little bit more about you and what you do at Digivate.
Sure, thanks, Pete. And I must be honest, this is my first podcast recording, so never done this before, but really excited to be on the show and to be joined by Lindsey as well. I've also got my Talking HealthTech socks on. I don't know if you can see them.
Yes. Oh, you get extra points for putting up the leg. That's it. The people on YouTube have to jump to YouTube if they're listening on audio to see the socks. But
exactly. So I'm on brand. Very nice quality. So thank you. Thank you for that. So my name's Lara Spence, based here in Adelaide. I'm founder and managing director of Digivate Health. That's a startup that's been going for just over 8 months now. So really, really great journey we've been on, growing very fast in the market. We are a tech sort of advisory business, but also work across strategy, implementation, benefits realization, and we really work with all sorts of healthcare clients, so both private, public, not-for-profit, and everything in between, and building a team that's really unique sort of composition that I haven't seen out in the market before. So we're taking clinical capability, we're mixing that with true genuine depth of expertise and technical capability. So a lot of the doers that actually build really cool things and not just talk about building the cool things. And then the third sort of stream is a real strategic commercial stream, what we sort of know what good looks like. So that's who we are. We are a national business as of next week. So we're South Australian born and made, but are actually going national from next week and very excited to do that. So that's a little bit about who we are. I'm a mum of 2 little girls, South African born. That's the accent that you're probably picking up if you're listening. British parents. It's been a decade in the UK as well. And I've worked across 3 continents, always in healthcare. And yeah, really, really pleased to be on the show and hopefully offer some of your listeners something new and something fresh and finding a bit more about us as well.
Interesting. Yeah, keen to dive into that a little bit more. You touched on, the importance of team and having those doers in place that have been there and seen it. That's probably a good opportunity to introduce Lindsey. Tell us a little bit more about yourself.
So hi, I'm Lindsey. I've got 41 years experience both in the UK and in Australia in the public health system, and most recently spent 5.5 years as the Chief Executive Officer of the Women's and Children's Health Network in Adelaide. By background, I am a clinician in pathology, of all things. But last year I decided that I'd done my time as a Chief Executive and wanted to use my skills to do something a bit different. And Lara and I had already knew each other, had gone back a little way and had worked together, and we decided to team up, and I've now joined Digivate and having a fantastic time.
Super. Well, look, before Lara, you touched on, I guess, some of the work or the problems that you're solving and particularly the experience that Digivate Health has. I'd love to unpack that a little bit more and understand, I guess, types of clients you're working with and the problems you're solving and I guess the why around Digivate Health.
Yeah, thanks, Pete. We obviously get this question a lot at the moment. And I think when I was thinking about carving out a new proposition for the market, I had a really great sort of opportunity to have a white piece of paper, a blank sheet, and really think about what are the challenges that I'd seen the market experiencing previously in terms of sort of outsourcing some capability or capacity build for their different organizations, what wasn't quite meeting the mark. So I spent a lot of time doing that. I also put a lot of time and thought into where are we now in terms of the market shift happening in healthcare. We know the challenges. Everybody's all acutely aware of the challenges, but are so fixated on that. They're not actually really spending enough energy in the right way of thinking about the opportunities and being creative about the opportunities. And we're so busy in reinventing the wheel in Australia rather than looking overseas or looking to the state next door around their sort of learnings and lessons. So I thought, wouldn't it be great to build a team that was nationally focused, that worked across the healthcare sector, so weren't necessarily just positioned in public health or weren't just positioned in the private sector, but actually could cross-pollinate those ideas. And I also thought, isn't it time we built a consulting firm that wasn't just filled with sort of consultants that had been a consultant their entire career and hadn't actually worked in industry? So I was really passionate about bringing in CVs into the fold that had exposure to different facets of the problem and also had different ideas to bring to the table. So that was sort of really the idea behind it. And I thought, well, we also really need to have a digital focus because that is where the market's at. The only way we're going to actually achieve some of the productivity gains that we're trying to get to and the efficiencies and the innovation is bringing in people that understand the industry, but also people that have worked across different parts of it. And also, most importantly, people that understand the technical landscape and can sort of translate that into something simple that from exec down to sort of operations on the floor, people are kind of moving in the right direction and are not sort of spinning around in circles, not actually achieving anything. So that was really the ethos behind it. Put people first, bring in those sort of 3 pillars of capability, partner in a true way. And a lot of good consultants do this already. But I thought, wouldn't it be great to also come really to the market with the thing that we say, we go first with a hybrid model. And what that means is, yes, we can come in and give you a few people. And yes, you can outsource all of your problem to us and we can try and fix it. But is that really sustainable? I don't think it is. So part of our proposition and part of our sort of awareness and education in the market is let's build a hybrid team. Sometimes it is more difficult. Sometimes it is more expensive and sometimes it takes longer to do it. But if we get it right, then when we as a consultants move off the problem or move out of that piece of work, there's enough legacy and there's enough knowledge in-house to sustain that project forward. And so we're very passionate about that. So those are some of the ideas we had, was really around those sort of main themes. And to be honest with you, the feedback from the market has been exceptional. I think we've really been overwhelmed with what we consider a fairly simple concept. It's just been so well received. And that really gives us a lot of confidence to keep going with what we're trying to achieve and what we're trying to do in this market. So yeah, that's sort of why it came about. We thought it's not been done before in this way. We can bring a different flavor, bring a different emphasis, knock down some of those silos, give people a chance that hadn't been in consulting before. And it's proving to be a pretty good recipe.
I like that, particularly the focus on giving that capability to the clients or to the organizations, because that's the last thing you want is that as soon as the consultant or the group kind of moves away, that's kind of, you've not really achieved what we want to set out to achieve, is building that capability. For some clarity before we kind of dive into it a bit further, Lindsey, when we talk about, I guess you've seen firsthand the different applications and uses of technology within healthcare, particularly in the healthcare delivery side. And across healthcare, it's pretty vast. We can go across devices and more in the bio side and the diagnostics, and then we've got the kind of pure digital health stuff. In terms of when we talk about digital health, and if we were to kind of hone into a few key areas, where are we kind of looking at?
Look, I think for me, and I'll touch on something that Lara just said as well, but for me, digital health is, as you have started to articulate, it's a very broad subject matter area. But I think for me, one of the most important principles is actually empowering patients to take charge of their care pathway. And I think so that they can make informed decisions, so that they can understand what's happening to them and actually be part of their care team by using these digital applications. And if you look at the National Digital Health Strategy, which we'll talk about a bit later, one of the fundamental pillars is patient-centred care. And so for me, one of the things I'm really passionate about is consumer-centred care. And so by involving the patients and actually allowing them to take charge of their care pathways and not be there in hospital and having care done to them, actually be part of that pathway.
Well, that's super important, isn't it? Like, there's a lot of focus on the healthcare delivery side, and sometimes it's a bit of a throwaway comment, unfortunately, of, well, yes, of course, the patient's at the centre, but there is that growing, focus or trend or need in particular to put the care in the hands of the patient, which is an interesting concept. You touched on the National Digital Health Strategy and how that's kind of this guiding force from a federal side, or at least within Australia, of how we're looking at digital health. I'd love to unpack that a little bit more and just understand how that might be aligning some priorities.
I was just about to say that, and I think Lara will expand on this, but the national strategy is actually a really, really good document. It's really clear about its priorities and what it wants to achieve nationally. I think the challenge for organisations such as health networks and where we can help them is by really looking at what you've already got in place, where that delivers part of the strategy, where you actually could be a leading light in that strategy for your state or nationally, and where you've got gaps, and then supporting an organisation with how they can bridge those gaps in a practical way so that it doesn't become too overwhelming, because it is a big document. It has got lots of initiatives in it. So it's about breaking it down into bite-sized chunks so that you know where to focus to improve your organisation, but also to support the organisations within your state and nationally to actually bring them up to the level that the national strategy wants you to get to.
And Lara, did you want to build on?
Yeah. So I would concur with Lindsey. We've spent a lot of time as a team over the last couple of months really unpacking that national digital strategy and having a lot of conversations in the market about it at the moment. It's very topical. And to Lindsey's point, it is a great comprehensive suite of strategic directions. And there's a lot of consultation that's happened across the board, right? Consumers, tech vendors, clinicians, healthcare service line managers, government. It's been really, really well done. But like with any 5-year plan, which is, it's hard to predict a year ahead, never mind 5 years ahead, right? But if you're looking that far ahead with the rates at which digital is expanding and enhancing this sort of way we deliver care, and we look at the initiatives and the roadmap that make up those 4 key outcomes, which are, person-centered, data-driven, digitally enabled, and sort of inequality of access or inequality, trying to curb that. It is overwhelming, and you've got heads of state and you've got digital leads saying that, right? It's not one state going, this is, I don't know where to start. I think there's a consensus that the strategic directions are good and the 4 outcomes are good. But when you've got different levels of maturity and different states at different levels of maturity, taking EMR rollout as one example, so electronic medical records, that's just one example of it. It means that different states and territories are going to have to really push ahead and practically look at the tactical things they can do over the short to medium term so that everyone in the organisation is clear on where they're putting their efforts, and if it's not working, how do they fail fast and move on to something that is going to move the dial in the right direction for those 4 outcomes. And also, how do they measure progress? Because what I'm seeing in the market, and Lindsey, you would have seen this too, is there's a lot of tired leaders coming out of COVID, budgets being squeezed, acuities through the roof, ramping has never been worse. And that disconnect between the different bits of the system means that leaders are kind of easily being able to be pulled into sort of storms of those cycles of, I don't know how I'm measuring progress, my team aren't seeing progress, I'm being sort of measured up from this angle and measured from that angle, and it's not connecting for me. So what advice we've been giving to clients and the conversations we've been having with clients is forget all that noise just for a second. Familiarize yourself with that national strategy because it is very clear and it actually is very practical, but localize it with your own lens in your own state and territory and your own business, whether you're a tech vendor in the private or public setting, it doesn't make a difference. Look internally at the practical steps and the practical initiatives that you're taking on a daily, monthly, quarterly basis. What are you measuring in terms of benefit? And it's not all financial. There's many other benefits and impact measures that you can put in place, outcome measures, experience measures, whatever it is, so that everyone feels that they're on the same page and also pulling towards the right direction and making progress. And I think once that momentum builds, it's much easier to feel like, we're doing this thing, like we kind of know where we're going. Whereas at the moment, I fear that there's a lot of bits and pieces happening in the system, but it's not very well coordinated and it's not being measured and tracked in terms of impact and benefit. And so a lot of those investments, which are millions, sometimes billions of dollars in terms of healthcare spend, we're losing a bit of traction and confidence from certain leaders because they're going, I just don't see the benefit. And that's really difficult when people are working really, really hard. And so, I think there's a bit of work to do around practically setting yourself up for success, maybe honing in on 2 or 3 or 4 key initiatives in the short to medium term sense checking that with your peers in other states and jurisdictions to kind of make sure you're not all duplicating the same thing or doing the same thing. So learning those lessons, sharing those insights. And maybe certain states and territories are better equipped and are in a better position to lead certain initiatives than others. So one example would be Northern Territory. Is Northern Territory better equipped because of the geography and because of the population to lead Aboriginal health initiatives, as an example, for the pilots that are happening around the country? Or, is there certain niches that they're trying to carve out and you should double down on that? Yeah, so that's some of the conversations that we're having currently in the market to kind of make it more real and give that support and give a clearer path and roadmap to success and sort of measuring success.
Yeah, it can be difficult when we're super busy all the time and got things to do and there's always fires to put out. But I like that advice of really honing in on the needs of the community in your space and then understanding how to kind of track that or measure that success to be able to communicate that across so that you've got a kind of path. I guess, Lindsey, you've been in that driver's seat for quite a while in the C-suite within the hospital space. Is that advice that you kind of would have appreciated at the time?
Yeah, absolutely. And just reflecting on, what Lara was just saying about the realising the benefits of technology that you put in place. I think more often than not, or very often, in healthcare, you'll put a piece of technology in place because it's the latest thing and it seems like a really good idea to do it. And it is a good idea to do it. But what you end up doing is putting it in place, but you don't realise the full benefits. And if you just consider something like ramping, it's something that the whole nation, in fact, internationally, is suffering from at the moment. And we're putting technologies in place that are meeting a need that's considered at the time, but could very well impact on the discharging of patients, patient flow, and it could impact and improve the ramping situation. So as Lara was saying, it's about making sure that you don't just realise the benefits that you're intending to realise from the piece of technology or the digital software or whatever it might be that you're implementing. It's about realising all of the benefits that could possibly be brought from that piece of technology that you're using. And it might not be what you're originally intending. So by working with people like us, we can work with you to identify, does this mean that in a certain area you're more financially efficient? You could be more productive. Your staff could have more time to do other tasks and other roles. So it is really more about making sure that you're optimizing what you're using and not just putting something in with a narrow focus on one thing that it can do, if that makes sense.
That's a great point, is that often we think that to solve this next problem, we might need another tool to kind of add to the link of many kind of things that all are supposed to speak to each other. But if we could take an approach of, well, let's take stock of the capability and the people that we have, but also the technology that we have, and speaking to those vendors and those stakeholders to be like, well, but being able to do that with someone from the outside who might have that broader view makes a lot of sense to me. Lara, you unpacked this almost like a Molotov cocktail of issues that we have within Australia, or actually probably anywhere in the world in terms of healthcare, in terms of increasing burden of chronic disease. There's the aging population. There's the push from the patient side of requiring more healthcare and having greater expectations, and then on the other side, the healthcare system is under-resourced and under pressure to do something about it. Are you, like, in terms of those conversations you're having with the different healthcare settings, I'd love to understand more about what those key challenges are, whether they're all aligned in the same place or whether there's, state by state, there's different nuanced ones. How do you kind of take stock of all these challenges that the healthcare system's facing in Australia at the moment?
Yeah, thank you, Pete. It's a great question. As I said earlier in the conversation, we're not short of time talking about challenges. We're very good at it. So, but, rightly so, there are some things that we got to wear, and there are some common themes that we see across the nation right now. And I think workforce absolutely is probably top of the list. And this is a real issue. So I don't have the exact numbers to hand, but when I was reading about it a couple of weeks ago, I think we're going to be tens of thousands short of GPs in the next couple of years, and a lot more than that in terms of nursing staff. And already, as I mentioned, we're feeling the pinch in terms of sort of standard work day, day-to-day work that the sort of workforce are feeling in terms of that tension and balance between clinical time with the patients and then being pulled into sort of administrative heavy tasks. And that sort of balance is not being met right now in the workforce. And, immigration, external factors, drivers, there's always push and pull factors, but whatever, it is what it is. And right now we've got a workforce shortage across the board in sort of clinical and non-clinical roles. Now, a lot of the non-clinical roles we can look at automating, and technology is definitely playing a role in that. But the clinical time that sort of workforce has, we want more quality time. And what we're hearing is clinicians want more quality time. They want less risk. They want to really hone in on personalizing that experience and that healthcare outcome with the person sitting in front of them. And so technology, the reason why technology is being talked about so much is this is the only thing that's going to at least alleviate some of the pressure in terms of workforce challenges. It's not going to fix it all overnight. It's going to be a journey, but it absolutely is probably that tipping point or that real pendulum swing that's happening now, going, why all of a sudden is budgets being released for infrastructure spend in this country, particularly back-end functions? If you look at aged care, the latest budget for aged care, massive amount going into that sort of infrastructure. It's because we have to alleviate some of the pressure of the non-clinical tasks, and we've got to look at risk, and we've got to look at quality of care. And so technology is the answer to that. The other thing that is challenging at the moment is there's no shortage of data. So healthcare data in this country is very rich. There is a lot of it, but it's inconsistent. It doesn't exchange very well with other sources of data. There's interoperability issues. So there's no shortage of dashboards. There's no shortage of little things popping up here, there, and everywhere in the system. But we have an integration issue. We've got a issue with predicting and sort of mapping future tech stacks. So traditionally, CIO roles in healthcare were non-existent. That's now changing, or head of digital roles were non-existent. The last few years, that's changing for a reason. So we're bringing people in, and the market is bringing people in that understand those challenges of data. Now, it's not about the data. The data is what it is. It's the insights you can glean from that data to enable evidence-based decision-making, to look for quality risks, to look for errors, to automate and make experiences better for consumers, so that you're not just a number in the system, but you've actually got a bit of a story and there's a continuum of care, and they kind of know where you fit in that system in terms of experience and outcome. So that data interoperability and insights, we have an issue for sure in this country. The other challenge that I'd probably mention is around regional and remote, or sort of access to equitable care. We've got a huge amount of patients and doctors working out in regions and rural sort of communities, all with different sort of backgrounds, cultural backgrounds, language barriers. And I think the navigation for those people is not ideal in terms of support. So there's a lot of work to do and investment to do in this country around that. And of course, ramping is a huge one. Didn't want to spend too much time talking about ramping or access and flow of patients through the system. It's not a ramping issue. That's just a symptom of a wider healthcare issue. And Lindsey will go into a bit of detail, hopefully in a minute, about this, because it's a topic she's very passionate about. But, as in healthcare, ministers and government are very fixated on ramping, because obviously it's the thing that is most visible in the system when you've got ambulances queuing out the doors of a hospital and patients literally dying because they haven't got access at an appropriate time. But with that being said, it's a wider healthcare issue, but it's also a wider social healthcare issue. It's housing, it's drug and alcohol, it's mental health, it's the primary care setting, it's aged care. It's not just people sitting on a ramp in a sort of an ED waiting to be sort of seen or triaged through an ED. That's what we see, and that's what we fixate on. But the challenge is much broader than that. And I think if we as a system and if government could look at it and band together, so not just healthcare, so yes, the issue ends up in a healthcare's bucket, but actually if government more broadly could look at the problem, I think we'd be in a much better place. And that's not just Australia, this is the world round. But Lindsey, I probably said too much. over to you.
I was also going to touch on the equity of access point that you brought up. My previous role was in Western New South Wales, which had lots of very remote communities. There's a lot of communities out there that don't have access to a GP, that can't get doctors or nurses, that rely on locums flying in and flying out. And virtual care models now are being developed whereby it's remote access, that they can talk to an ICU doctor, they can talk to an ED doctor, they can talk to a specialist doctor and get that care remotely, so that even if they can't get a physical person on the ground, they can access the healthcare that they need. And I think that's really important, because for so long those remote communities haven't been able to access the level of care that some of the metropolitan areas have been able to access, just because they're so far away. And I think it's important to call that one out. But on ramping, obviously I've spent a long time in the acute healthcare sector, and Lara's right. The front door is what we see on a day-to-day basis as the symptom of not being able to get people into inpatient beds, because people are in inpatient beds as they can't get out to an aged care home, or they can't get a national disability package, or that the ED's blocked because there's a mental health patient that really needs care, but we haven't got sufficient mental health capacity to get them moved to. There's all sorts of different blockages that I call them 5 different ramps. We've got the people waiting for an ambulance, the people waiting outside EDing an ambulance, the people waiting in the ED for a bed but can't get into a bed because patients haven't been discharged, patients in beds who can't be discharged because there's no aged care bed, for example, or no maintenance care bed to transfer them to. And then, a lot of patients can't get in to see a GP, so they go to an emergency department. So there's a whole system, as Lara said, and a whole state and national-wide collaboration that's needed to try and fix these issues that will then fix the front door. It's not all down to an ED and an ED's processes, and technology is just one of the things that can help solve all of that.
No, I think you've both articulated that quite clearly, and to that point as well, that whilst we could always do with more, like we need more clinical people across the board, but as you kind of suggested too, that's doesn't matter where you look around the world, we're all kind of facing that same problem, and in some places more so than Australia. So, it's not about throwing more people at it. It is a very human-centered kind of service, healthcare. So there's this, interesting balance of how can technology and digital health then be supporting and augment some of those the human level of care to improve those outcomes, and again do that within financial constraints. So there's this opportunity then for digital health to really capitalize on some of those opportunities that present and address the challenges that we face. And there's, like Lara already suggested too, we're not short of data, and we're not short of, I guess, the opportunity to do, and there's always technology that's available in this fast moving space. Where do you kind of see, Lara, then, or I guess prioritize some of the best ways that digital health can be utilized within the health setting to really start to curb the trend on some of these issues?
So one thing that I've been thinking about a fair bit around adoption of technology in healthcare, and why we have traditionally been slow adopters. And I think it goes back to the fact that clinicians, if we take them as one cohort, spend many, many, many years perfecting their craft, learning their craft, and they are the experts. And for tools to come in, or digital things to come in that they're not either comfortable with, or it sort of affects and makes their sort of day-to-day life and sort of practice uncertain, I can see why there's some resistance to that. Plus, we've got the double whammy of dealing with patients' lives in terms of healthcare, the consumers we serve. So we are risk averse traditionally. And so when I was speaking to software vendor recently, so these are real like Gen Z and Gen Alpha people coming through with amazing ideas and saying, you know, I've managed to sell this technology into every industry but health, and it's amazing, and I can see the benefits in healthcare, but I'm just not getting traction. And he said the penny dropped for him when he went on a bit of a mentoring course for healthcare specialist sort of vendors, and they said the key to healthcare technology is making it as invisible as possible. So other industries, it's flashy, it's beautiful, it's imaging, it's, you know, it's, you can feel the technology in the user interface and it's brilliant. Healthcare is different in that you kind of want to make it as invisible as possible so it doesn't almost appear to be there. And in that, if you can crack that, you get high adoption. So I thought that was just an interesting sort of thing to think about in terms of why we've been slow to adopt, but also the reasons behind it, which I think are quite valid. So that then brings me to the next bit of the conversation, which is sort of those opportunities and where we see the biggest opportunities. And it's a hard one for me to kind of put in order. So I'm not going to do it in order. I'm just going to kind of put the top 3 things that I'm thinking about at the moment and clients are talking about. It's around efficiency and productivity. Because of all the challenges we've just spoken about, if we don't get more efficient and more productive with the time, that is, we're not going to get the funding. First of all, people's lives are at risk, you know, like we've got to get more efficient and we've got to get productive. So the technologies that are allowing clinicians and consumers and also people in the healthcare system to do that are really coming up sort of trumps at the moment and are doing well in terms of workflow, sort of optimization. The other things that are doing well in the digital space is the remote patient monitoring and those tools that are allowing patients to kind of age in their home or get better at home or just sort of open up options for consumers to sort of experience their healthcare in the way that they choose to do that. And having some sort of remote monitoring is one example of that, where people can actually do it in the sort of comfort of their own home. So there's a lot of investment going into sort of alternative models of care. So what we mean by that is the model of care of how that practice is done today might not be fit for purpose if someone's location changes or whatever it is. So you have to almost redesign those models of care. And I think where there's a huge gap, and we see this, and Lindsey and I were talking about this to a very important person last week in the system, where we are really concerned and we are worried is that you're getting new facilities built for billions of dollars in this country, and we're not bringing in enough people that have the smarts to design what those future models of care look like. And I know it's a difficult question to answer because who knows what things look like in 5 to 10 years. I understand it's sometimes like having a crystal ball, but what's happening is we're generally taking today's way of delivering care and we're building new hospitals or new facilities, and we're kind of just lifting and shifting the current models of care to the new building. And that's not going to work. You know, in 5 to 10, 15 years, that's not going to work. So is the layout correct? Is the blocking and stacking correct? Is the bed to ratio virtual versus inpatient correct? Probably not. So I think where there's opportunity massively for digital and for people that understand tech and virtual models of care is thinking to the future around how do we future-proof things as much as we can. It's never going to be future-proof completely because that's not realistic. But how do we redesign things? How do we get bold with how quickly things are getting disrupted today? And what does that mean for clinical care settings in the future? What does it mean in the way that we deliver care in the future? And how do we get early access to some of that thinking today and make sure that it's translating and there's a transition plan from today to next year till the next 5-10 years as best we can. And I don't think we're getting that right at the moment. Lindsey, would you agree?
Yeah, I would agree, especially with your point about the infrastructure. I mean, just an example of what is possible and sometimes what comes out of, for example, the pandemic, that comes out of something like the pandemic that was totally unexpected was a virtual service that was set up here in South Australia for families with sick children. And that became incredibly successful to the extent that it became a permanent fixture. And there's now a process whereby instead of taking a child to an ED, families dial into the virtual healthcare system and can see a doctor, a nurse, get their treatment, get a prescription sent virtually, whatever it might be, and don't have to turn up to an ED. And that happened just because of the circumstance of the pandemic. the reason I give that example is because, when you design a new facility, you might not think about a service like that could be completely virtual. But the fact that now it's been evidenced that it can be, a future design should cater for that. And maybe you don't need as big an emergency department, maybe you do. But all of those factors need to be taken into consideration when you're thinking about the future, because things do change as the years go on, as we all know. And so we need to make sure that we've considered that when we are designing facilities, designing new hospitals, even designing new wards. What should it look like? Where's the future of that service, and what's a contemporary model of care, and how does digital technology and digital care fit in with that and support that?
Yeah, it's so true. And I was thinking as you were talking then as well, it's almost like because this is to the point that Lara made earlier as well, the best technology is the ones that you don't really notice. It works behind the scenes. We almost need the technology within healthcare to be like, the trains. Like no one puts a big compliment into Sydney Trains to say thank you so much for making my train run on time. It's just something you expect. And I guess, and I was thinking about that example that you gave of the virtual models of care from a patient side. They shouldn't be so impressed at how technically advanced the solution was. It should just work and be easy to use and feel part of their usual day because they're using their phones throughout the day as well. So I think that really puts the challenge out there, not just to the vendors, definitely to the vendors, but also to the health systems in designing those models, particularly, like you said, Lindsey, in new builds, that we've got this opportunity with demonstrated capability that there's this chance to redesign how we think about some of these, like what a patient flow is and a consultation is, to build a sustainable solution. So I guess to round out the conversation, there's a lot of great insights there for both the vendor community and those in the C-suite running the hospitals. I guess if you were to summarize in a few key points to both, if you might start with Lindsey, the key takeaways for those within the health system looking to advance some of these solutions and make an impact and address some of these challenges around digital health, how would you kind of summarize that?
I think, having come from the healthcare system, and Lara might expand on this, but it's about working with partners that help you not just understand the kind of technology that you should be implementing, but understand where you're positioned in terms of putting that in place and what you need to do to make it successful. Put it in place, but then make sure that you realise the full benefits, even those that you don't realise that are benefits. And I think coming from the other side, that's something that we haven't done well in healthcare. So I think really to maximise the benefits of what we're able to do with technology in healthcare, which I think is a lot more than we think we can realise.
That's great. Yep. And Lara?
I think for me, the thing that comes to mind is what we typically see in market is people go from, oh, there's this cool idea, there's a shiny thing, oh, we need some money. Okay, I think we've got the money. All right, let's implement, right? That's typically what we see happening currently in the market in terms of process and steps. And what is actually happening is a whole lot of steps are being missed in that cycle. So we try at Digivate Health do a lot of work around education around what are the actual steps that you should take to complete that cycle and do it in a successful way. And one example would be what we've sort of called a digital maturity assessment. Now, there are a few of these in the market, but we haven't seen anything that's quite like what we've designed, and that in an ideal situation, you would start with your problem, not start with there's this thing over there that we should implement. It's like, what is the problem we're trying to solve? And is everyone really clear on what that problem is? All right. What are the solutions out there? Not just the ones that are beautiful and shiny and great presentations by some slick salesperson. It's genuinely doing some due diligence on, is this solution compatible to the problem I'm trying to solve? And that sounds really simple to do, but it's actually not. And that is something that I would really advise people in the system to think about, either doing really rigorously internally or outsourcing that piece to someone independent that can look at your functional brief, look at your functional requirements, and ensure that the quotes that you've got coming in from vendors is meeting and going to meet your expectations in terms of the problem you're trying to solve. Because we often see a mismatch between those two things, very often, almost daily. So So that's something I would say, if you're thinking about the digital and tech investment, got to get that bit right. And then there's a business case piece to do, but there's also an operating model piece to do. Again, we see people not doing this. They go straight from, I want that thing, here's the money, everyone team implement, and they wonder why it fails. So there's a lot of work around operating models. So if I get this new thing in, or this new piece of kit, or this new insight, or whatever platform, how does that change the way we deliver this process workflow currently? And is everyone clear that that's going to still meet the brief in terms of what the outcomes are? And that's a lot of work. Operating model review is actually a lot of work and should happen before implementation. But what we're seeing is people go straight to implementation and then they go, oh, crap, this is not working. So that would be my other bit of advice would be get that operating model right before you implement. And like I mentioned in the beginning of the conversation around that hybrid team approach, it's very rare that you'll have an internal team that can deliver a massive piece of work and do a massive implementation, whether that's a back-end replacement of an ERP or a new EMR rollout. Like, you probably need to lean on external capability, but how do you do it in a sustainable way that's a partnership so that you upskilling your capability internally for the long run, and that knowledge stays internally and doesn't go out the door when the project's completed in 12, 6, 18 months, whatever it ends up being. So that digital maturity assessment that we're trying to put together practically and quantitatively wherever possible looks at the domains of governance. It looks at security. It looks at capability internally in terms of skill sets you've got. It looks at risk. It looks at funding. It looks at business case elements. It looks at operating model. And it kind of gives you a really strong sense, whether you're an exec or someone on the ground operation leading this thing, where those gaps are, so that everyone's going into that investment with their eyes wide open around where those possible pitfalls would be and how do we bridge the gaps and how do we tactically get the team moving to kind of make sure this is successful. So yeah, that was a long answer, Pete, but I think it's really important to point that out, that we are seeing in the market that not happening in those steps. So it's going, I want that thing, that quote looks good, that looks shiny, great, let's get it in and get it moving. And unfortunately, we're spending millions, if not billions of dollars across this country kind of failing at that. So we need other consultants also around the country to also have a long and hard, honest look at themselves around where are we adding value? How do we set this kind up for success for the long term and not think about as just, gleaming profits? And how do we genuinely partner in a way that's sustainable and also point out things to clients if they're not quite getting the bits right, or we're coming in, it's, sometimes as a consultant, you're only brought in at the end. You brought in an implementation stage and you had no exposure to any of these earlier steps and you're now trying to make it work. And so I think if we as an industry, consulting as an industry, can get on the same page going, that's not good enough. How do we educate? How do we genuinely look at this cycle in a better way and make sure that the client's ready for the step that we're proposing they should take? And if they're not, they're not. But then have that honest conversation around how you can support them to get to that point. But also have a bit of fun with it. No one's perfect. Everyone's out there doing their best, and I think clients need to feel that they're not alone. I think one thing that would be my final sort of closing sort of thought is, whether we're talking to clients in Canberra, South Australia, Queensland, they're all going through similar trials and tribulations. And there's still a lot of passion out there in the healthcare industry. People genuinely working very, very hard and always putting patients first. And there is a bit of excitement as well out there in the market at the moment. People can see how technology is positively impacting the system, because it is. There is so many success stories out there. There are so many great things happening. So how do we get those messages out and, as I said, build momentum, measure benefits and make a real difference? And, we won't always get things right. That's okay. How do you kind of move on to the thing that is going to get you to where you need to be, and do it with a smile on your face, and remember at the end of the day, we're all here, doing our best. So, yeah, that would be probably my closing.
That resonates with me, Lara. Like, I like how you think about that, and that's, we'll make sure the details for some of those tools, like the maturity matrix and other bits and pieces in relation to Digivate Health, are in the show notes of this episode for people to check out. You've, of course, got the the strong presence on our website as well. People can learn more there. So it's been great to kind of unpack some of these challenges. And whilst it can be, we're all feeling that those challenges on a day-to-day on the front line and in the healthcare delivery side, but there certainly is opportunities. And I think if we can take that considered approach to addressing some of these issues with key partners, as you've outlined, I think there's going to be success to come. So, Lindsey and Lara, I really appreciate you making the time to have a chat. Thanks so much.
Thank you so much. Really enjoyed it.
Thank you.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.